Shalom and welcome to this edition of Seekers of Meaning, the podcast arm of Jewish Sacred Aging. I am your host, Rabbi Richard Address. I'm also the director of Jewish Sacred Aging. Welcome and thank you for joining us. With these podcasts, we hope to explore issues related to our own aging and the implication of longevity for our families and community. And we welcome your comments and suggestions to me. You can go to Rabbi Address at jewishsacredaging.com. You can visit our homepage, the website, jewishsacredaging.com, and also our Jewish Sacred Aging Facebook page. We're covering social media. And there's some Twitter and other stuff, but I don't want to bother you with that right now because we have a very, very special guest. and it is with great pleasure that we welcome Robin Cogan to Seekers of Meaning. Robin is a world-class, established, award-winning school nurse, blogger, podcast participant on the faculty of, right here in New Jersey, of Rutgers University, and is a school health fellow. Lots of honors and awards. Robin, welcome. It's nice to see you.
I am so happy to see you. Oh my goodness. I feel like I'm with my old friend, and
Well,
I am thrilled that you invited me. Thank you.
Well, we have lots to talk about. You've had a busy year, I imagine.
Oh my goodness. It's been a busy year. Yeah.
So let's talk about that because as a result of the pandemic, in many ways, the nursing profession as a whole has really been honored and elevated, I think, in ways that it hasn't before. What's been on the ground? What's been your take on some of the shifts and changes in the nursing profession as a result of this last year and almost year and a half?
Well, I have to tell you, I have some breaking news for you, Rabbi Address. Today,
Beep, beep,
yeah,
beep,
no,
beep,
it's
beep.
good. It's all good. Yeah, breaking news. Today is the release of a once-in-a-decade report called The Future of Nursing from the National Academies of Medicine. The last time it was released was in 2010. So this time it's for 2020 to 2030. And in the future of nursing, it's all what I'm most excited about is that school nursing is included in the what they are recommending for what we need for our communities to be healthy moving forward. And not just because of COVID, but certainly COVID elevated the profile of nursing, especially school nursing. So I'm really proud, excited. In fact, as soon as I'm done with our podcast today, I'm going to get right on the release of the actual report. And I was one of the speakers at one of the town halls in Philadelphia at Penn in 2019 to talk about what school nursing needed in the next 10 years. And I'm thrilled to know, other people obviously contributed also to the school nursing piece, but I'm thrilled that they have taken our recommendations.
Robin, what led you to this particular aspect of nursing? Was it an event, a person, an encounter, or did you have an aha moment in the middle of the expressway?
You're going to love this. You're going to love this answer. What led me to school nursing was a summer I spent at Camp Harlem.
At Harlem? Oh, wow. For those of you who don't, Camp Harlem is, the Reform Movement has a series of maybe a dozen camps. Camp Harlem is by far the finest of all of these camps by huge distances. It's located in the Pocono Mountains.
Leaps and bounds.
Yeah, and that I remember because I've been involved with camp since 1963, but I do remember you were on staff there. So talk to me about why did that summer at Camp Harlem with all these kids running around
changed my life? It changed my life. So it really was from Camp Harlem. I was in my nursing career. First of all, before I became a nurse, I was an art therapist. And then I went to nursing school. So pretty much my nursing trajectory has been a little bit upside down, backwards, and a bit of a roller coaster ride. So when I did become a nurse, I focused on mental health, psychiatric nursing, substance use disorder. That was my primary area. I moved into case management. I eventually ended up in occupational health, and I worked for Conrail, the railroad. For
Oh
about
yeah.
5 or 6 years, I was the health service manager, and Conrail was taken over, and I had a bit of a sabbatical, and my kids wanted to go to camp. So I called I called camp thinking maybe they'll let me in. Little did I know, if you breathe and have a nursing license, camp wants you. They need school nurses
They want
desperately,
you
or they
could do
need
it this summer.
nurses desperately.
Yeah, they do. They do.
So I went to camp with my kids, and the other nurses in my bunk, and they're still my dear friends, were school nurses. And I thought, this. I spent the summer. I spent 4 weeks at Camp Harlem that first summer in 2000. And I had to return back to school because you have to have school nurse certification in New Jersey. And I returned back to school, and the first day of my first class, I hadn't been to school in years. The instructor said, if you would like to work in she called it a needy school district, Camden City is hiring. So Camden speaks to me for many reasons on many levels, personal, professional. And I thought, this might be a really important thing for me to do. So I went to, I put in my application, and I was immediately hired, and I have been there for 20 years. But it was all because of that summer at Camp Harlem. And I spent 10 summers at Camp Harlem.
Um, the Your experience in Camden opens the door to I wanted to ask you about one of the things that the curtain has been pulled back with this pandemic, that there's no secret anymore of the total inequality of access to healthcare issues in various neighborhoods around the United States of America. Camden is a disadvantaged area, the city in New Jersey, but there are mirror Camdens all over the United States. Um, how do you begin to account what was it like to deal with the children who just don't have parents who can pick up the phone and get into the finest pediatrician or the biggest cardiologist or whatever the expression is in our area, but really they may not ever see a doctor. You may be the primary healthcare delivery person in their life. How does that impact their life? What is it? Just tell me how
Yeah,
that
so
happened.
you're absolutely right. I do want to frame this by saying that I like to call Camden and cities like Camden urban rich communities, because the richness of the culture and the richness of the family life and the richness of the diversity in a city like Camden, I think gets lost sometimes in the other stories that are told. So after spending 20 years in that city, I can say that I can I walk with cultural humility every day into that city too. But I am one of those people. I do not work where I live, and I recognize that. So I've also come to terms with the reasons that I work in Camden, and I feel like one of the best things I can provide for my students and families is care coordination and helping them make those connections, because all, people want for their children. They want them to be well. They want them to flourish. They want them to be healthy. But not everybody has necessarily the skill set to access this very complicated healthcare system that even people, I've heard medical doctors who become patients say that they can't access this very complicated healthcare system. So one of the main roles, I think, of a school nurse, especially in an urban rich community like Camden, is to really understand what the family needs and help them find those resources, and then really be that that navigator to help guide them through the systems. Right now we've returned to school recently. There's been so many stumbling blocks in the city in terms of COVID. I'll give you just one quick example. When we first closed, I noticed on social media that a lot of my families really weren't understanding this whole idea of physical distancing. First of all, the name social distancing really is a misnomer. It should be called physical distancing. And many of my families, they don't work in inches and feet, they work in the metric system. So tell somebody to stay 6 feet apart when they think in meters doesn't compute, right? So we did a series of, I call them public service announcements, but they really were conversations with some trusted and credible messengers in the city. People people are going to listen to those that they trust. They're not going to listen to the CDC and Dr. Fauci and all the other kind of noise that was going around. So that was a helpful series of conversations. We did one on mental health and behaviors that families were seeing. We did one on the importance of following these public health strategies. And when you have families that there are multiple generations, multiple families living in a house, you have families who all of a sudden they are the essential workers because they work in grocery stores, they do home care. These are really the working poor keeping our country moving during this pandemic. And so the challenges were just enormous, but people really rose to the occasion. And what I have seen is that, like I said before, everybody wants their children to flourish. What that looks like in a city like Camden, it looks like what it looks like in Cherry Hill, but I don't think it gets enough attention. You know, I mean, I've been back to school now for almost, I guess, 6 weeks, and the kids are flourishing. And I had a little girl say to me today, and she really almost made me cry. She said, "Miss Robin, I am so happy. I can't believe I'm back in school with my friends."
Yeah, that's true. That's true.
Mm-hmm,
I
mm-hmm.
picked that similar things up with from my grandchildren and others. Robin, you mentioned the mental health issue, and I keep coming across this all the time in the Jewish sacred aging work, the impact of the pandemic, the isolation, this rise cross generations of mental health. What are you seeing in your work with these kids coming back to school? Are you seeing some mental health issues percolating?
You know what? I think if you look at from a broader lens, I'm seeing a collective trauma that everyone has experienced. And I think we're processing it differently, right? So, we can say that we have all been in the same storm when it comes to COVID. We've been in the same storm, but we've been riding out the storm in very different boats. Some people are riding this thing out in a yacht. Some people are riding it out in a rowboat with a hole in the bottom. Some people are clinging to a buoy for dear life, right? So that's where the impact of the stressors, the anxiety, that's what I see. I see parents really doing their best, but in impossible situations. People have lost homes, people have lost jobs. Certainly, children have been separated from loved ones. Some children have been sent out to either other states or even countries of origin. During COVID, there's been a lot of separation of families of multiple generations, and yes, what I see is I see a very stressed workforce. I see exhausted people. I read a really interesting article a couple days ago about languishing, this sense of kind of a malaise, and it's I think we have to look at the impact of COVID as the grieving process, as in terms of well-being. How is our well-being? you know where are we, and how are we recognizing it? We can't just go back to business as usual. COVID isn't over yet. um,
No.
we're still in the midst of it. It's definitely the things are much improved, but we still are dealing with the current and the aftermath. So
Is it safe? Is it really safe to say that this has been a collective societal trauma?
I believe that with all my heart. I believe this has been a societal trauma, that this is a shared trauma. We've all experienced it differently. And, I read a really sobering statistic that more than 40,000 children have lost a parent from COVID, school age children.
Yeah, I'm
And
not
of
surprised.
those 40,000, there are a higher proportion of them are Black and brown children. And that's another sobering statistic. So, when you talk to people, you asked me at the beginning, is my family well? We are very fortunate. Yes, we are well. But I think all of us know someone who has died from COVID, who has COVID long haulers, who have, continued continued symptoms from COVID. It has touched everyone in some way.
Oh no, I haven't. I haven't. Rarely in this year and a half. I guess it's a year and a half now. Talked to anybody. Certainly my colleagues, and me included, who've done funerals and shivas and stuff like that because of COVID and over and above. It is traumatic, and the isolation. I guess that's why I came back to that mental health thing, because um, somebody in our generation, they can verbalize this. I don't know whether a 6-year-old or an 8-year-old, you know, how they process this trauma. They may, I've seen some people say, well, kids are more resilient. They can process it better. But my other readings in, some of this stuff say, no, that trauma just stays with you. You just have to learn, you learn where to put it and how to deal with it. But that trauma doesn't go away.
Oh, I think COVID is going to be considered, if you're familiar with adverse childhood experiences and adverse community environments. I mean, they call that the pair of ACEs, right? I think COVID and what's happened is going to be considered one of those adverse childhood experiences, because we want to think that kids are resilient, and many people are resilient, but we don't know. It's still new. We don't know the ramifications. I mean, right now, what I'm seeing is, I feel like the honeymoon phase of being back in school is wearing off, and some typical behaviors are showing up at school, but also some atypical behaviors, separation anxiety, maybe not as, I feel like in education, we're doing our students a disservice pretending that COVID didn't happen and thinking that we can still do standardized testing and it won't impact our kids. And we can still follow the school calendar, but we need to stop and say, wait a minute, we have been through the most consequential time that I remember in my 60 years on this earth. And what about our kids, and what about our educational system? We have to pivot and respond to the needs of the day, but we have to take an honest look at it too. I think we do everyone a disservice by pretending it hasn't impacted us the way it has.
Are you finding more people now attracted to nursing generally, because of the publicity,
Oh, that
because of the
hero
heroic
term. Oh,
aspect?
don't call
Uh,
me a hero. Um, it's interesting. I find many of my dear friends and colleagues, including myself, I've gone through this of really considering retiring, considering leaving, feeling very disheartened by some of the things that have happened. And yet there's also a huge push for new people to come into public health and to come into nursing and medicine. And so there's that yin and the yang, right? There's the positive and the negative of what all of this has meant. I think that school nursing, first of all, has always been a hidden healthcare system forever. We've been a hidden healthcare system. Now there's been a spotlight shine on what we do. It has been this, I think, for many years. And so that's a big plus. But having said that, there's still 25% of schools across this country have no school nurse at all. 35% only have part-time school nurse. So only 40% of schools actually have a full-time school nurse. And if there's one school nurse to 2,000 students, one school nurse to 4,760 students, like there is often in Washington State, what can our impact actually be? How does that weigh on the profession? And I think that's what nurses have experienced. We're trying to talk clearly about, we're not superheroes. When you call someone a superhero, then you're putting aside what they actually need to do their job safely and effectively, because you should be able to handle it. You're a superhero, use your superpowers. But that is putting us in an unfair place that isn't realistic. So I think we need to take this time to say, let's really use our nursing voices once and for all. There's almost 5 million of us, and ask for, not just ask, demand safe staffing. Really, we should no longer tolerate intolerable work conditions. When COVID first started, can you imagine, looking back now, there was not enough PPE safely to provide to nurses. People have been using their personal protective equipment over and over again. I mean, just, we need to look at all of the things that went right, because some things did go right, but we also need to acknowledge where we missed the mark, and we have to do better.
So you allude to something. You sort of like just alluded to something in your what you just said. You wrote a column for the American Nurses Association. I think talking about nursing is political.
Yeah,
I think that was the phrase that you used, if I remember
you are
correctly, looking
absolutely
at the
right.
article. And I was struck by that because I would say if you lined up, 100 people at random and say, "Do you think nursing is political?" Oh no, nurses are no. On the contrary, they're the most apolitical. They're just there to help me. But you just walk to that border saying we have to raise. There's 5 million people. That's a chunk of people.
There's only 1
Walk
million
me through.
physicians and there's 5 million nurses. So if we would use our voice to the same power that other professions do, we could get a lot done. And the reason I say that nursing is political is because, first of all, we have a license to touch people. That's actually, in a sense, almost radical, right? So
And
nursing
that's
is, yeah,
this day and age.
in this day and age, right? So nursing is political because, we have children separated from their parents at the border. We know the health implications of that. We have COVID, where the public health, our most trusted public health institutions like the CDC were politicized for an agenda of an administration that was very unsafe. I mean, we have to use our voice when it comes to when I say nursing is political, it's political, especially when it impacts health policy and it impacts the
Mm-hmm.
structures of healthcare. So yes, I do believe with all my heart nursing is political. And there are
So the
colleagues who
current
disagree with me very much. I know that.
really.
Oh yeah.
So the conversation right now in Washington, this is going to post in the beginning of June, and we're recording this 2 weeks earlier. So the conversation will still, if it even starts, uh, about this increased funding for family leave and health issues and access. Are the nurses associations uh, lobbying for this? Are they making their voice heard to pass some of this legislation?
Yes, and that is absolutely wonderful. So the American Recovery Plan, is that what you're talking about? The
Right. Right.
ARPA, right. So yes, absolutely. And what I'm really excited about in this Future of Nursing report that is being released today is that they are asking for nurses, school nurses especially. I only looked at that section, of course, because that's my focus, but they're asking for school nursing positions to be funded in all schools, because we can't be effective if we're not there. And when you look at COVID, it's just astounding to me, the where when school nurses are not present, who is doing the assessments of people who are coming to school not feeling well in a non-COVID world? But how about in a COVID world, when now you're talking life and death, right? You're talking about spreading this virus. You need somebody in there who can translate this ever-changing public health strategies. You know, the CDC changes their guidelines frequently because the science is updated, because the research is released. It's not, and you have to be able to stay on top of it and be able to explain why the science is changing. Like right now, I'm happy, but I'm very concerned about the vaccine, especially for children. This could be the huge game changer that we have been waiting for and hoping for. Because right now, school feels very sanitized. School feels very medicalized, and I feel like if we really could embrace this idea of vaccine confidence, especially with our children and our school staff, we could change what school looks like. Not that, we can't go all the way back yet, and we probably shouldn't, because school really needs to be revised and, rejuvenated, and this is an opportunity. But in terms of relationships, in terms of proximity to students, in terms of, what we have to do now to keep people safe, the vaccine is the game changer. It really is. And the vaccine for children is the game changer. So that is very
Do you,
good news on the horizon.
do you see schools being like a center for the delivery of those vaccines? And if so,
Absolutely.
how do
We
you deal
did
with
it.
them with the parents who no, I don't want my kid to be vaccinated.
Well, I don't I don't foresee right now schools making it mandatory. I mean, some universities have. In fact, Rutgers was the very first
Yes,
one
I
in
know
the
that.
country.
Right.
Right. So I don't know what's going to happen on, on the elementary, secondary education level. I don't know. But I mean, in New Jersey, we make the flu shot mandatory for all students 6 months to 59 months. I don't know if they're going to do that for the COVID vaccine. I don't see them doing that right now. What I see is the ability to educate, encourage, be that trusted person that families can go to ask about COVID vaccines for children. And making it convenient. You know, when H1N1 happened, first I need to plug school nursing once again. It was a school nurse in New York State who worked at a Catholic school whose students had traveled out of the country in 2009, and she noticed that there was a very curious increase in fevers in her students. And she wanted to report it to the health department, and her principal instructed her not to. She did it anyway because she needed to. She knew that was the right thing to do. And those were the first cases of H1N1 in this country. Now, the difference with H1N1 is that it was a known virus. It wasn't a new virus. So
Right.
we had a vaccine rather quickly, and we had vaccination clinics in our schools for H1N1 back in 2009. And it wasn't mandatory, but H1N1 is now, or a form of H1N1 is now part of all flu shots every year, different variations.
Wow.
Yeah.
Hmm.
So
Hmm.
so we have this opportunity, I think, to encourage vaccine confidence, to be the example, to answer questions, to quell you know these conspiracy theories that I hear all the time, and listen deeply to people's concerns, not brush it off, and not um, you know not what is the word? You have to meet people where they are and understand their concerns. No matter my position, I need to understand what is your perspective? What is stopping you? Can we work together? Can we talk about it?
I mean, looking forward, as you're alluding to in a minute, you did a recent podcast too, that talked about trends and innovations that's going to impact health. And before we start running out of time, I do want to ask you about that pod and what you meant. What, as moving out of this and moving forward, what are some of those trends and innovations that you see impacting your profession and I guess the wider sense of public health as well?
Well, I feel like we need to take the lessons that we haven't yet even began to collect with COVID and put them into action. That we have to work across sectors, that we cannot be working in isolation, that we have to understand that science has to drive our decision making, and we have to pivot over and over again when the science is showing us something new that we didn't know before. In terms of innovation in nursing, have for us, I believe strongly that nurses using their voices, being seen as the health expert that they are, being sought after to be the primary source for a healthcare news story is innovative. It shouldn't be, but it's innovative. So, nurses have to, in my mind anyway, feel more comfortable with media competencies, seek out healthcare journalists, tell our stories. If we don't tell our own stories in nursing, other people will tell stories for us, and they don't often get them correct. So, this whole time, there has been a lot of focus on what nurses have done, the impact of nursing. But yet, it's interesting. The other day, and maybe I shouldn't say the hospital system, but there was a commercial about a hospital system that just did a big renovation, and the big message in their commercial was that we have, the top tier physicians. They didn't say one thing about who actually staffs that hospital. So we need to expand people's understanding about the work of nursing, the educational level, that where nurses can be. Nurses are across all spectrum now. There are nurses in business. There's nurses at Microsoft. There are nurses, with MBAs. I mean, nursing is across all fields. And I think we have done ourselves a disservice by not being more vocal and verbal and writing about it. We're great at talking to each other. We're great at talking about our own research. We're not so great at the outward facing messaging. We have to
Well,
get better.
I mean, no, this it's just listen to you. It's very. My sense is that the future of nursing can be very, very exciting
Yeah.
because things seem to be opening up and different fields and aspects and avenues of nursing. I know there's a greater number of men going into nursing.
Mm-hmm.
There just seems to be a greater opportunity to expand and if we pick up your idea of the using of those 5 million voices to further public health and the healthcare system, how much the more so. Robin Cogan, first of all, the blog is the Relentless School Nurse, if I'm not mistaken.
You are
That's the
so
name of your
right.
blog.
That is the name of my blog.
And if somebody wants to say, that there, she speaks my language, I want to read some of that. How does one access the Relentless School Nurse blog?
Relentlessschoolnurse.com is where my blog lives.
That's,
And I also follow me on Twitter at Robin Cogan. I love Twitter. And I also have a Facebook page for the Relentless School Nurse as well.
okay, so they just go to Facebook and type in
Relentless
School Nurse, correct?
Mm-hmm.
Rock and roll. Robin Cogan, thank you. It's so great to see you, even though
So
on the
good to
Zoom
see you.
machines.
Yeah, but we're
Hopefully
used to it now. We're used to it now.
yeah, we are. It's the new. It's I was at a congregation recently, and it was the first time they actually let people in the building in over a year, and I said it's nice to see all of you. I thought all of you just lived in a little 2-inch by 2-inch box, but
True.
actually that's what you really look like. My God,
True.
it's pretty cool. It's pretty cool. Listen, say hello to the family. Stay
You
safe, stay well,
too.
and thank you for all your good stuff and your
Oh,
work.
well,
And
thank you for
just
having me.
hopefully,
I'm
oh,
honored
it's
to be on
fun.
your show. My goodness.
Oh well, I love you. Thank you very much. You
Take
just take
care.
care.
Thanks. Bye.
And to all of you, thank you again for watching or listening to today's edition of Seekers of Meaning, the TV show and podcast arm of Jewish Sacred Aging. Remember, the show is available as a TV broadcast on the Roku streaming service. Ask your grandchild, they'll tell you exactly what that is. And again, we welcome your comments and suggestions to rabbiaddress@jewishsacredaging.com. The Facebook page, and if you'd like to make a tax-free donation so that we can continue the work of these podcasts and the program, just go to the website, jewishsacredaging.com, and click on the conveniently located donate button. Seekers of Meaning is produced at the Broadcast Center of Lubetkin Media Companies in bucolic and lovely Cherry Hill, New Jersey, and a big shout out to the genius producer, Steve Lubetkin. I'm your host, Rabbi Richard Address, and I look forward to greeting you again on the next Seekers of Meaning TV show and podcast. In the meantime, until then, stay safe, everybody, stay healthy, and shalom.